Hi guys, my name's Erica Malovich, and today we are going to be talking about polio and post-polio syndrome, my acronym PPS. So the first thing we're going to talk about is, what is it? So poliomyelitis, otherwise known as polio, is a serious disease caused by a virus. This virus specifically is a disease of the anterior horn of the motor neurons of the spinal cord and brainstem. For post-polio syndrome, this is somewhat of an extension of polio, just because this syndrome only occurs because of the initial polio that they had in the first place. Except this just has new symptoms of weakness, joint and muscle pain, and fatigue. So, the symptoms. For polio, there are two different types of polio. One is non-prophylactic, which it means there's no paralysis effects. And the issue about this one is back in the day, in like the 1950s and 60s, when people got polio, they thought that they just had the flu because the symptoms between polio and the flu are very similar. So for non-prophylactic, the symptoms are fever, sore throat, headache, vomiting, fatigue, back pain or stiffness, neck pain or stiffness in the arms or the legs, and muscle weakness or tenderness. Now for prophylactic, which means paralysis, they have symptoms such as loss of reflexes, severe muscle atrophy or weakness, and loose and floppy limbs. For post-polio syndrome, this is progressive muscle fatigue and weakness and pain. They usually have a ton of muscle atrophy. They have breathing or swallowing problems, sleep-related breathing disorders such as sleep apnea, and decreased tolerance of cold temperatures. So the next thing we're going to talk about is what causes it. For polio, it is kind of an RNA virus. It enters the enterovirus group of the Precarious family, which then is secreted in saliva and feces during the first 1 to 3 weeks of having polio. And this is what makes it such an easy transmission between host to host, especially because one of the main groups that was being diagnosed with polio were children. So if the children have it and then the parents go to take care of them, it's just another way to transfer the disease. So once you're infected with the polio virus, it can attack your GI tract, and then from there it goes to your lymph nodes, and then it can go straight into your bloodstream from there. Once it reaches your bloodstream, it kind of gives you a higher risk of it hurting your nervous system. And once it gets into your nervous system, it affects everything. It affects your central nervous system, your peripheral nervous system, everything. So there's two kind of triggers within the body. One of them being the chromatolysis, which is when the distribution of Nissl bodies gets sent out throughout your body, and one of the triggers is a viral infection of the CNS. And then another is glossus, which are when glial cells get sent out once your CNS gets attacked. And the reason the virus can get into your nervous system is because it gets through the blood barriers. And it can also get in by axon transportation from the peripheral nerve. For post-polio syndrome, however, it's just decompensation of the chronic denervation and reinnervation process to the extent that the remaining healthy motor neurons can no longer maintain new sprouts. For the prevalence and risk stratification. So the prevalence of polio, it has gone down immensely since we came out with the vaccine. Before this, as you can see from my graph to the right, there was an extreme spike from about 1940 until the vaccine was created and used in 1965 within the United States. That being said, the populations that are at higher risk are children, individuals with isolated religious sects, and by this I mean a group such as the Amish, just because they don't get involved with governmental programs, and one of those being vaccinations. So unfortunately, they're already at a higher risk just from not getting the vaccination itself. Another two groups are pregnant women and individuals with weakened immune systems. For post-polio syndrome, the prevalence rate out of all the people with polio that end up getting post-polio syndrome is between 22 and 65% of all the cases recorded. And right now, the current proximity is 1.6 million cases. So the populations that are higher risk for this group are patients who sustain substantial permanent impairment after polio, and also females. So how do these diseases affect exercise? So for polio, especially with the prophylactic, just because it has paralysis and muscle atrophy, it makes exercise extremely hard, if they can even do it at all. Patients are usually bedridden, and their vitals are constantly being monitored just to offset death. After the symptoms subside, though, which the symptoms usually last around 10 days, you can get physical therapy or speech therapy or any kind of therapy that your doctor will recommend depending on what you lost, and possibly gain back some function and mobility within the first months to 2 years. After 2 years, it's uncommon to see much progression. For post-polio syndrome, their main thing is it causes weakness and joint and muscle pain and fatigue. So when you exercise, it's really important that you focus on the intensity and the duration and frequency of when you exercise, because if you're doing it too often or too hard, they aren't going to be able to function the next day, and that's not the point. So how exercise affects them. Because there's no cure for polio, once a person develops the virus, treatments are kind of focused on increasing comfort and treating the symptoms. So like I said before, this could involve bed rest, antibiotics, painkillers, ventilation because it's hard for them to breathe, and swallowing. And physiotherapy is the same thing as physical therapy, moderate exercise, and a proper diet. For post-polio syndrome, physical activity has been shown to significantly increase lower extremity strength and aerobic capacity, and furthermore, regular exercise can help you maintain your weight and reduce your risk of developing other diseases. And the reason I bring up weight is because most people who do have post-polio syndrome usually are overweight, just because exercise is difficult for them, and it's harder to keep your weight off or keep your weight at a healthy range, just because you could fatigue more one day and be fine the next. For medications, again, polio, there's no cure for, whether it's polio or post-polio syndrome. So for polio, you have to get the vaccination. It provides immunization for life. For post-polio syndrome, it's you can go from either over-the-counter drugs such as aspirin or ibuprofen all the way to anti-inflammatory drugs and opiates. So we're going to bring all this together and talk about a case study that I made. So this woman is a 58-year-old female. She is overweight and has a BMI of 28. She had polio when she was 4 years old. She is suffering from major fatigue and is having issues with activities of daily living, breathing, and also swallowing food. She does not have major issues within her lower body. However, her upper extremities, she's having issues reaching her full range of motion. She lives a relatively sedentary lifestyle, and the only medication that she takes is ibuprofen when needed. So for an exercise test, there's really no test to confirm confirm post-polio syndrome. Your doctors will just do certain tests to rule out other diseases until they come down to a final verdict of post-polio syndrome. But for this, her goals for the exercise prescription is to improve her mobility, to improve her activities of daily living, considering she said that she was having issues being able to do certain things, and her overall health. So for strength exercises, we're going to focus mostly on her lower extremities, just because it's not recommended to work out your upper body if you're not at full range of motion. This could create so many more injuries and fatigue that this individual does not need. So we're going to be doing that for about 3 sets of 10 to 15 reps at a low weight for the major muscle groups, about 3 times per week. For aerobic exercises, we're going to be walking outside and on a treadmill using at a low intensity. You could also use a stationary bike, just because that takes out her upper body but can still work out her lower half. And we're going to do this 3 to 4 times per week and the goal is to get to 30 minutes. If she can't get there right away, just because she is going from a sedentary lifestyle to working out, we can do lower bouts until we reach that goal. And then for flexibility and stretching, what she wants to do is try and do it almost every day, and if not, please every day, just to improve her range of motion, her muscle length. And stretching has been suggested to improve her pain management, improve flexibility, reduce her risk of osteoporosis, and reduce her risk of falls. So some special recommendations for this population specifically, one of them being when you do go to start a program, I highly recommend having an exercise specialist with you, whether that be a physical therapist, an occupational therapist, an athletic trainer, somebody to be able to show you the correct form and tell you if you're doing it right, and to be able to progress you in a way that is best fit for you. My second recommendation is if you're experiencing spasms during exercise, you need to lower your intensity and increase your recovery periods, because your body is telling you that you're pushing it too hard. For the third one, if you're experiencing a lot of fatigue, it's a sign that you're overdoing it. And I know everyone wants to push through and get better, but you can only do that in baby steps, especially with this disease. You can't push yourself to a point where you're making it worse for yourself. And that's why I highly recommend, again, from the first recommendation, to have a specialist with you. For number 4, when fatigue is significant, you also might need to consider lifestyle changes. So if you are going to work out later on in the day, maybe earlier in the day, you don't do certain activities, or you don't push yourself to a point where when you go to exercise, you can't. For number 5, when your weakness is significant, strength exercises might not be helpful. So I know in my case study, I had previously said that we were only going to focus on lower extremities, but if she just got done doing stairs, it depends on her house, and she's feeling major fatigue, I would never push her to a point where I would make it worse. And finally, for my last recommendation, I would try and do stretching and aerobic exercise almost every day if possible, just because of the health benefits that they give. So, these are my references. I hope you enjoyed my video, and I hope you guys have a good rest of your day.